let's go over your payday terms first really quickly. Let's move on to the muscles just for a second. Okay, so new payday terms. Some of these may be a review, some other stuff we have. So ambulate means to walk. That's just a medical term for walk. So somebody says, well, you've probably seen, like in the emergency room or something, it says ambulatory care. Okay, it's kind of like in and out kind of thing. Okay. But ambulate just means to walk. Orthopedics is the science that deals with the musculoskeletal system, like an orthopedic doctor or orthopedist, a physician that does that. Lordosis, this is abnormal curvature of the lumbar spinal region. Okay, so where's your lumbar spine?
Bottom.
Lower back, right? That's where it arches. So lordosis is where it's like it arches too much. You got too much of an arch there. Syndactyly. So dactyl means fingers or toes, could be fingers, toes, phalanges. And syn means together. So syndactyly is where you have like fused fingers or kind of like webbed type fingers or toes. Polydactyly then, poly means
more,
many. So polydactyly means that you have more than your normal number. So six fingers or whatever, 6 toes. Sometimes that can be associated, babies are born with that, can be associated with like heart disease or something along those lines too. Touch Towers had an extra thumb. Oh, thank you. I think I'm going to say that. Okay, scoliosis is an abnormal lateral curvature of the spine. So lateral means what? What's the word lateral?
Both sides.
Sides, right? So laterals to the side. So what that means is, whereas lordosis is like, here. Okay, so whereas lordosis means it arches this way, scoliosis means it arches this way, like an S. So it curves laterally. Okay, does that make sense? And then the last one, kyphosis, is that on there?
Mm-hmm.
Oh, I didn't put kyphosis on there. Okay, kyphosis is a posterior, like an overarching of the thoracic spine. So if you've ever seen somebody with severe osteoporosis and they have that kind of like humpback look, that's kyphosis. Okay. So lordosis is in the lumbar region. Scoliosis looks like an S, if we think of it that way. And then kyphosis is where we have that osteoporosis. We didn't have that one on there. I should have put that one on there. Strain, this is when a muscle is injured by stretching beyond its normal limits. And there's different degrees of strain. You can have like a mild strain where it just hurts for a couple days. You can have like a 2nd degree strain where it's more intense than that. It requires some treatment and then goes from there. Okay, look at the difference between a strain and a sprain. A strain is a muscle injury. A sprain is an injury caused like in the joint or like tendons and ligaments usually are involved. Okay, so strain is muscle, sprain is more skeletal. And then remember the difference between tendons and ligaments? Ligaments connect bone and bone, bone a la bone, okay? And tendons are muscle to bone. Contracture, this is a hardening of the tissue that results in immobility of a tissue or joint, and we'll talk about that some today. And then a fracture, FX is short for fracture. ADL, activities of daily living. Any ideas on what that might be? What are some activities of your daily living?
Walking.
Walking.
Eating.
Breathing. Bathing. Going to the bathroom. Those are all activities of daily living. Things that that you need to be able to do every day. I put that in with this unit because that's a big time like therapy kind of thing that they would do. Does ADLs with assistance or requires assistance to do ADLs. You hear that one a lot. IM is intramuscular, like if you're getting an injection, like a shot, it's IM. Well, not all shots, but ones that go into the muscle are. RICE is short for rest, ice, compression, and elevation. So if you have an injury like a sprain or a strain or contusion or some kind of injury, that's rice is kind of your go-to like first aid kind of thing. Rest it, you put ice on it, it helps to constrict those blood vessels, they won't be so leaky. Compression, put some pressure on it. That same idea is like we, like if somebody's bleeding or something, it kind of helps that from leaking out. And then the elevation keeps it from gravity causing it to swell more. Makes it move around. And then PT is physical therapy. I think we've had that one before. Big P, big T. Not to be confused with little p.
Patient.
Little t. Patient. Yeah. Okay, cool. You guys will have tomorrow to work on your project as well. Okay, and then Thursday you guys will present them in here. So make sure you're ready to go Thursday. You've had lots of time. You still have tomorrow. Make sure you're ready to go. Don't be reading your notes Thursday the whole time you're giving your presentation. You are the expert on your particular career that you picked. Okay. All right, let's talk about the muscular system really quickly. This will take just a few minutes. 3 types of muscle that we have: cardiac, smooth, and skeletal. Okay, cardiac muscle, where would you expect to find that?
Heart.
In the heart, and only in the heart. It's the only place you see cardiac muscle. So it's a very specialized, if you'll kind of look at that picture of the cardiac muscle, a lot of them, they're like really branching cells, and they kind of interweave when they connect to each other. And the purpose is that you want your heart to beat, right? These particular cells have to carry electrical impulses. And so they have these special little junctions in between them where that electrical impulse can jump between the cells really quickly. Very, very quickly. And so you want your heart to beat rhythmically, right? We talked about that in the last unit. So we want it to be the way that it's supposed to. And the cells are shaped in such that it can do that. And that's why they intertwine and branch so that it can move very quickly. Obviously, the function of your cardiac muscle as a whole is to circulate blood through the heart. Okay, visceral or smooth muscle. These are on the internal, or you see these, find these in the internal organs, anywhere where you have muscle internally. Digestive system, all along the digestive system, you see a smooth muscle. It's called smooth because if you look at this picture, look at the difference. These little lines in this other muscle cell are called striations, and this smooth muscle cell down here doesn't have those. You see it in the bladder is another place where you see a smooth muscle. Respiratory system around your bronchi. Okay, those have smooth muscle. Blood vessels able to open and close as needed. Those have smooth muscle tissue. Every hair in your body has its own muscle. You know that? Every hair on your body has its own. It's called an erector pili muscle, and it's what makes it stand up if, like, you get scared or if you're cold. You know, your hair stands up like when you get goosebumps. Okay, that muscle contracts. Isn't that crazy? So that's another type of smooth muscle. Anyway, of course, these cause movement in these particular organs. Skeletal muscle is attached to bone for the most part. There's a few exceptions to that, but for the most part, it's always attached to bone. And it's what causes our body to move. Now, what's one difference do you see already between skeletal muscle and these other 2 types of muscle? Yes. Okay, so good. Skeletal muscle is voluntary. Okay, we choose when we want to do that. All right, we move our arm because our brain decides we want to move our arm. Okay, I don't tell my heart when to beat. That would be tragic. I would be dead. I would have forgotten to tell it. Okay, so we don't do that. Same thing with food muscle. Every time we eat, we don't have to tell our stomach to turn the food and then tell our intestine to move the food. It all happens. It's involuntary. All right, some muscle action. So ways that we move. More vocabulary. Okay, adduction. This is moving a body part toward the midline or toward that sagittal plane. If I've got my arms out, adduction is me moving them towards my body. If I've got my legs out, adduction is moving them in towards the center, the midline of my body. Okay, abduction is just the opposite of that. Abduction is moving a body part away from midline. Okay, Now, I always remember this kid's abduct. I think if somebody abducts someone, they take them away. Like that. I had a student last year who said that she remembers it because abduct, the B is facing away from the A, and the D is facing towards the A. So, remember it like that. Okay, flexion is just bending. So, you can't, this particular type of flexion, we're talking about muscle actions as a whole, like your arm, like flexing your arm is usually bending. That doesn't necessarily mean that's what's going on in every muscle. Because when you have one muscle that's flexing, another one is always extending. Like they work in pairs. So like your bicep and your tricep. My bicep flexes to pull my arm up. My tricep is extending or being extended. It doesn't extend itself. But it makes sense? Kind of, they're like a pulley system always. Okay, extension is just straightening. Rotation is turning on an axis. Okay, so that means it's more of like a twisting motion. Okay, like rotating. If I take my arm, this would be rotating. Okay, and the next one, circumduction. Circumduction is moving in a circle. This would be circumduction. Okay, so circumduction and rotation. Does that make sense? Everybody see the difference in those? All right, a little bit more vocabulary. Muscle tone. This is a state of partial contraction. So your muscles always have a tone to them. They're always like partially contracted. That's what we consider your tone. Now, there can be different illnesses that cause different problems with that. Somebody might be hypertonic, or I don't know if you could really be hypo, but hypertonic for sure. So they are a little bit more sensitive, kind of reactive. Or if somebody is paralyzed, they may have no muscle tone. Atrophy, we've talked about this word before, but it's just where the muscles waste and they decrease in size because you haven't been using them. So that's atrophy. It can be from a number of reasons. If somebody is paralyzed and they're not using those muscles, or the electrical impulses aren't making it, the neurons aren't sending messages for them to move, then they would atrophy. That's just wasting. And that can happen too if you're just not getting enough nutrients. Contracture. So severe tightening in a muscle and a flexion due to inactivity. So causes like their joints to constantly be bent because that muscle, and it will harden that way. I mean, it can just like tense up and kind of harden that way to the point that you cannot move. I mean, you cannot move their arm. I mean, it would break their bone. That's how strong those muscle contractions can be. So.
Teachers, pardon this interruption. I have a couple announcements to make. Don't forget about the 3-on-3 tournament starting Thursday. You need at least 3 players, no more than 2 varsity players per team. The cost is $375 per player. Tomorrow night, the varsity baseball team needs everyone to come out and show their support. They're playing for a spot in the playoffs. And also, if anyone has seen a white iPhone 4 charger, someone has lost it. And junior high students, remember tomorrow for anti-bullying week, your day is to wear cap. Thank you.
So that's a contracture. And contractures can be really, really strong. You see these a lot in people who either are immobile, like they can't get out of bed anymore just because maybe they're too weak, or they've had a stroke and can't use one side of their body very well. See them a lot with stroke patients. Their hand will like curl up, or their wrist will curl up, or their arm, and they can't use it because it's just like a constant muscle spasm kind of in their arm. And it can be very, very painful. You know, almost like a constant cramp kind of feeling. So, and then a muscle spasm, another word for a cramp, severe, sudden, painful, involuntary flexion. And contracture is a long-term. This is a chronic problem, whereas a muscle spasm, you know, when you guys have had cramps before, muscle spasm before. Fibromyalgia, 3 diseases or illnesses. So myalgia means what? Algia, that's the end of the word. Pain. Myo is muscle. Fibromyalgia is a constant, a chronic muscle pain. We see it a lot. I don't usually see it like middle age, but not always. Fatigue. What's fatigue?
Like laziness.
Laziness, more of like a decision that you make. I would say tiredness. So tiredness, malaise. Sometimes you'll hear that word malaise. That's the same idea as fatigue. Don't feel good, kind of achy. Stiffness, like muscle stiffness, numbness or tingling. You'll hear that a lot. People who have muscle problems or neuron problems, headache, depression. You'll see that depression comes a lot with chronic disease and especially chronic pain. See lots of depression with chronic pain. And that's just, I mean, you live in pain all the time. How do you not get depressed about that? Treatment for symptoms, but there's no cure for it. They're going to battle it. Sometimes there's a commercial out that's for fibromyalgia I've seen. Or I think maybe for Lyrica or some kind of medicine like that. Okay, muscular dystrophy. Dys means what? Do what? Difficult, labored, bad, like dyspnea. We talk about dyspnea. So dystrophy, trophy is formation. So like atrophy is without form. We talked about before. But this is a group of diseases that causes severe muscle atrophy. Okay, and you think about it, it's not just like arms and legs. It can affect even involuntary muscle too. So the treatment for this is physical therapy, but again, there's no cure for this. There's not a cure for a lot of these muscle type diseases. Kind of like they're kind of vague. They can't pinpoint any one cause. A lot of them are just genetic, and there's just not a whole lot that they can do about it besides just treat the symptoms. Myasthenia gravis is another one, and this is where the nerves don't properly transmit to the muscles. So it's another chronic disease. Signs and symptoms are muscle weakness, paralysis because their muscles are not getting the info from the brain that tells them what to do. It can be fatal if it starts to affect their heart or their cardiac muscles. And then again, no cure, and there's really no treatment for that either. Not a lot of hope with these diseases. But they're not, most of these, not all of them, some of them, yes, but a lot of these kinds of diseases are not, you have them for a long period of time. I mean, they're chronic. It's not something that's you're gonna get, and then the next week you're gone, So, anyways, that's that very quick muscle chapter. So just kind of scratching the surface a little bit. But y'all work on your projects tomorrow, get them done so you're ready to go Thursday. And the test for this, I think I put it on there, but we won't have it till Tuesday.